Good morning. And so part of our time crunches, we are standing up a pop-up test event at Silver Spring Civic Center today, where we hope to test somewhere between 800 and 1,000 individuals during that time period. And so we're working to get that moving forward today and making sure that it goes off without a hitch. So I will actually combine my comments. I'll try to be succinct to leave time for questions. But I did want to provide some data updates based upon our last conversation on Friday and some of the exchange and the proposal that we received over the weekend. For those watching at home, we did submit a testing strategy plan that builds on what we have been doing for a while now and adding new features and components that were driven by the surveillance and epidemiology data that we have at hand. And that was shared with council, and that has been released from my understanding. So I want to, if I'm successful in doing this, share my screen and be able to share some of these documents that I'm referring to. So the first document that I want to share is data that we've compiled that highlights the tests that have been done, particularly in those zip codes, the top 10 zip codes in terms of volume. Also breaking it down by looking at how percent test positivity has changed over time as our numbers have improved significantly across the county for all geographic areas as well as racial and ethnic categories. As we know, though, that we still have some work to do. So I want to preface this by saying that we have had overall, if you look at our data dashboard and you look at it in the context of other jurisdictions, our numbers have improved significantly overall. Our daily case counts are averaging well below 100 on a consistent basis. And that is significantly improved from about 6 weeks ago, where I think June 1st, we had a 3-day average of 255. We now are seeing, we've had multiple days in the last week where we've not had any COVID related fatalities. And I think these days, one is too many, but we're seeing 1 to 2 on a daily basis, which is significantly better from 40 and 45, where we were seeing over a month to 2 months ago. We know that even in spite of that, that we still have this 60 to 70 cases on a daily basis. And what we have been working to do is to have a deeper understanding of why, as we've significantly improved, and again, the improvements have been experienced by all of our geographic locations with the county and all of our racial and ethnic categories within the county. But why do we still have some persistent cases? And so that was the impetus behind sharing data with you all last week. And continuing the conversation to say, how do we address those potential social determinants that are impacting continued transmission in certain communities? And so with that in mind, I would like to, again, share my screen. Let's see, I'm going to go to test volumes first. All right. So we'll walk through this quickly. This is looking at test volumes and percent positives for COVID-19 in the higher volume zip codes. And I'm speaking on these because I know they were specifically called out in the proposal that you all are putting forward for testing. So when we look at test volume over time, this is inclusive of those high volume zip codes. Here's the zip code. You're looking at the number of tests that have been run in the zip codes by each month. This category shows the percent of the total tests that have been run by the county overall. And this is the percent of population within each of those zip codes that have been tested. These are all approximations and estimates based upon the surveillance data. And that shows that, with the exception of, and then this last category shows where these zip codes stand in terms of the top 10 number of cases. So with the exception of 20874, all of them have tested over 10% of their population, which is consistent with the governor's request that each jurisdiction test 10%. And it's important to note that as of this morning, we have tested 11.2% of our population, which is over approximately 114,000 folks, and conducted nearly 150,000 tests. And our test positivity overall is 4.2%, which is below the state average, and we have tested a higher percentage of our population than the state. But this gives you a sense of the test volumes across those high volumes zip codes and where they stand. And this is a graphical representation that shows you how testing has increased across the county, but in particular in these zip codes over time, from before April to June. And the preliminary estimates, if we go back to this chart, you approximate just based upon the first 10 days of July, all of these estimates, if you multiply by 3 as an approximation, will show that we will have higher test volumes in July than we had the previous month for all of these respective zip codes. And it's important to note for this one zip code that is at 8.4%, it's in the Germantown area, I believe. We are ramping up our testing there and putting one of our trailers that we're receiving from CDC that's been signed off and should come within the next couple of days in that area as a testing hub to increase testing access there to get them to a higher percentage of the population tested. Now, when we look at the percent test positivity over time, from my understanding, this was also addressed in the resolution that you all have put forward. Now, certainly back in April and May, where we saw the majority of our cases happen, we saw that there were some significantly high test positive percentages during there across these zip codes. You can see that I think in some of them, there was even in 03, there was a test positivity of 86%. That has decreased significantly, and now based upon the July number so far, it's at 1.6%. And you can look across the board and see how these numbers were higher, and they've continued to trend down for all of these respective zip codes. And in the month so far of July, based upon the data we have, you can see that the test positivity rates have improved significantly. And as we've talked about before, the two factors that drive test positivity, your numerator is the number of cases that you have, and your denominator is the number of tests that have been run. So in this setting, we have both, we've addressed both issues. We have decreased the numerator, so we're seeing lower numbers of tests across the board, positive test results, in the setting of increased testing, and the denominator is increasing. So that is why you have seen a significant improvement in the test positivity rates across all of these zip codes. Again, when you look at the top 10 that are identified based upon these categories, you see significant improvements and significantly lower test positivity rates as time has moved forward. Now, again, this is a graphical representation of those high volume areas to show you how, yes, we did see some peaks of test positivity in April and May, and they have continued to trend downward to now that they are in the single digits, below 5%, which is actually the state average this morning is 4.8%, and actually most of those are below 3% as well. Now, I do actually want to pull this out. I'm going to shift gears a little bit because let me see if I can also check my other document here. Give me a second. So one of the other things that was specifically called out that I wanted to address is the notion of there being a test positivity rate in the Hispanic community of over 70%. That's actually just not factually correct. The test positivity rate for, I'm actually going to share with you breakdowns for non-Hispanic white, non-Hispanic black, non-Hispanic Asian, and Hispanic based upon the categories that we have for the data that we receive for test data, both positive and negative samples in our surveillance system. And so the 73% that was referenced, as we discussed, does not relate to test positivity. So again, for folks watching at home, 73% test positivity would mean that 73% of anyone in the Hispanic community getting a test would come back positive. The data that I just showed and will show now shows that that's just not an adequate representation or an accurate representation of what that means. What 73% refers to is that the percentage when looking at the makeup of our COVID cases, that's the percentage during that time period that fall into that category. So in the month of June, 73% of the new cases were in the Hispanic community. And so it's about percentages. But when we look at the overall composition of COVID cases across the county from March to here, Hispanic residents, for the data that we do have, make up 37% of COVID cases. Non-Hispanic Black make up 15%. Non-Hispanic White make up 17%. And non-Hispanic Asian make up 3%. And when we look at test volume and test positivity, which is what is shown here in this chart, the first part looks at the overall numbers for the county for test volume as well as test positivity. And again, I want to emphasize that racial and ethnic data is missing in approximately 25 to 30% of the reports that we have, the surveillance data. So we're reporting and estimating based upon what we do have access to. And so I'll just walk you through this in point of comparison. So the first, the test volume here report represents both tests done, so positives and negatives. And then the test positivity, and for overall, I mean the entire county. For test positivity, that refers to the number of cases divided by the total tests run during that time period. The second set of data here for each racial and ethnic category refers to the test volume and test positivity specifically for those 10 highest caseload zip codes. And so when you look over time, and forgive me, I'm going to have to scroll up and down my screen here in terms of being able to showcase the numbers. For example, when you look at non-Hispanic White population, you can track the test volume. And I will say this, we are working on the test positivity for July. It's pending. We did calculate that. Dr. Liu was able to calculate that specifically for the Hispanic community since that was specifically called out in the resolution. So I wanted to make sure we had that point of comparison for you for July as that's discussed. But as you can see in this group, the test positivity rates did peak in April and have trended downward. When you go to non-Hispanic Black population, similarly, we did see higher test positivity rates early on, both overall as well as in those top 10 zip codes. They have trended downward, and in June, in fact, we speculate that in July they will continue to move down, but they had already shown, much like this group here, 1.8, 2.7, they had already shown significant improvements in test positivity from there to now. And the same thing for the non-Hispanic Asian community. We've seen a peak in terms of test positivities, and those numbers have trended downward from across the board. And again, we predict that based upon that and based upon early estimates that those test positivities would be even lower for the month of July. And then when we look specifically at the Hispanic community, you can see similar rates. In fact, when we look at test volume, both for the county as well as those top 10 zip codes, we see higher volume of testing compared to any of the other categories, in fact, which contradicts the statement that there has been lower testing in that community. And again, we understand we need to increase testing. We're increasing testing strategically based upon this data, but I want to use that to level set the conversation and clear up some issues around the interpretations of data. And again, when we scroll down here, we see that, yes, there were high test positivity rates, particularly in April and May. They have trended downward in June. There were decreases, which is consistent with what we previously said, not as high as in other areas, but based upon the preliminary data that we have from the first third of July, the test positivity rates have actually decreased even more significantly to 1.5%, approximately 1.5% for the county and 3.3% for those top 10 zip codes. So I say all that to say, and let me stop sharing my screen here, is that the data shows we have made significant improvements in numbers. And again, going back to my statement and sharing data previously, the goal is to say, how do we push forward and how do we move forward and how do we identify any other pockets of transmission within the community broadly? And how do we have a more sophisticated and deeper conversation about how, what's the impact of social determinants of health and other types of things such as housing security, housing situations, type of employment, access to medical care and access to health insurance and primary providers to be able to provide those follow-up services, because we know that they're not only going to be beneficial addressing those is not only going to be beneficial in terms of improving COVID outcomes, but they're also going to be fundamental in our conversation as we continue to address the long-standing health disparities that have plagued our county and plagued many communities across the board in different conditions. Now, in order to move forward, you all have received our strategy around increasing testing. We have we're increasing the number of permanent sites available for folks to come in and test. That includes building on our existing sites, and that is already in the works. As I mentioned, we are working with CDC to bring in trailers. They've been approved, everything's set up. One will be delivered to Dennis Avenue, hopefully this week, and the other to Lake Forest Mall in the Gaithersburg, Germantown area. Additionally, there was previous conversation around ready responders. They are present. They were getting onboarded yesterday and today, and will be going out this week to resume testing on site in facilities. Our mobile test team continues to test at shelters and group homes throughout the county and supporting testing also at assisted living facilities. And we just this week, we actually have 8 pop-up test sites that have been introduced and scheduled, including one at Silver Spring Civic Center today, Tacoma Park again on Thursday. There will be a pop-up test site in Poolsville on July 18th. There will be a pop-up test at the East County Rec Center on the 21st. And I think the church is Oakdale Church, and only on the 22nd. And then Goshen United Methodist Church on July 25th and April 1st. And in addition to that, we will be adding 4 of our Montgomery Cares clinics. Will be providing testing as well. We worked with them on that and putting that into place. And again, in addition to all of these, we continue to seek new partners to do pop-up testing, as well as identify other venues where we can extend testing opportunities, partnering with them, whether that is an episodic pop-up test event or something more long-term in terms of providing additional assistance and support. The last thing I would mention is we recognize we don't have all the answers. And part of that is we reached out to, as I've mentioned to you all before, partnering with Prince George's County and the state to get additional assistance from the CDC. They sent a team to support us last week, and they are meeting with, they've been able to participate in some of our pop-up testing events to explore how we can improve community outreach, removing barriers to testing and addressing any barriers that may enhance transmission for certain folks within the community. And they will actually be meeting with different community organizations to discuss strategies to continue to enhance the response so far and address the needs of the community. I will stop there, but happy to answer any questions. I don't know if Dr. Stoddard will present, or we'll just go to questions right away.
We're going to need to go to questions, Dr. Gayles, because of your your time frame, and I guess Dr. Stoddard is in the same. I did want to mention that Dr. Crowell is with us as well. I'm going to, because of the time, I'm going to ask my colleagues to keep it to 5 minutes. We're going to have to, because we're under a crunch here. But the first council member to speak is Councilmember Reamer.
Thank you so much. Thank you, Dr. Gayles. I appreciate the presentation, and I think we all do, the executive branch's testing strategy that we received the other day. I think a lot of us need to have a written strategy to feel comfortable, to understand, to have a chance to suggest alternative approaches, to hold the executive branch accountable, which is, of course, our obligation. So it's a breakthrough for us, I think, to be able to have something written, and the goal of the resolution that we're also introducing is to formalize that so that the county council has a chance to approve something in the end. Just to talk process a minute, what I recommend we'll do here is try to harmonize what you've provided us with what the draft resolution says, and then next week we would approve something that everyone feels achieves what we want to achieve. So and then we'll have that going forward. So I think it's a big step forward. I thank you. I do acknowledge, there was some misunderstanding about some of the data, as you explained, and that last chart you showed that says that 70%, in June, 70% of people who were tested positive were Hispanic. The graph itself, or the chart itself, says percent tested positive, and I think I misunderstood it as test positivity, which is a different thing, and it creates a different problem, or points to a different problem, I should say. The underlying challenge, I think, is that we're succeeding with many parts of the community in driving down the virus. We still have a ways to go, I think, especially with our Hispanic community. So, a larger point stands, but we will fix that misunderstanding or misinterpretation in a resolution that we ultimately adopt. So for my colleagues, the things that have been, what you had before you was a draft. I know Councilmember Navarro, for example, has language that she would like to see reflected in what we ultimately pass. So, Councilmember Albernas and I work together to prepare this. We'll take the executive branch. We're going to have work to do over the coming days to kind of pull everything together and have everyone's input. I'll try to just very briefly say, first of all, I think we are a jurisdiction that overall is handling it better. Right? We are not Texas. We are not Florida. We did not turn our back and encourage denial of the virus and put our hands in the sand about how to handle it. And I think our shutdown orders and how we've handled it have been effective. And I think we have the results that speak to that. But at the same time, I think we're all worried that the exploding transmission outside of the county is going to boomerang back here. And there are dozens, if not hundreds, of Wuhans all around the country now, and it's going to find its way back. They're at the borders, it seems to me, and it may just be a matter of time. So what we want to do, and what we're hoping that we can now do through this process, is all be on the same page about the peak that we may confront and what kind of a system we want to have in place, when it potentially, if it does climb back up. And so, having real specifics about the testing and the tracing and the isolating, and trying to drive towards a 3% or lower positivity, I think is, what we understand as being an effective response. We have had some differences or frustrations, right? And I don't need to go into those necessarily at length, but we have asked in the past about testing, and there was an intention to have 10 to 20,000 county provided tests per week, back in May, and we haven't reached that goal. Now the capacity is there. We still have a long way to go to meet that kind of goal, and a lot of it has to do with just the hours that testing facilities are open. Up until very recently, we had 20 hours of county provided test administration, per week. I think many of us believe we could be exponentially larger in the amount of time and availability of testing, and get towards, need a test, get a test, walk in convenient locations all around the county with pop-ups going into hotspots with online scheduling. I'm glad we're finally getting online scheduling up this week. I think that is something I've personally talked to residents who were self-isolating, 10 seconds, and couldn't get an appointment because the phone system was down at HS. So we will, thank you. We'll be working in the coming days to bring everything together, and hopefully next week we'll be able to move forward with a new written plan that the public has seen and we're all on the same page about. Thank you.
Thank you. Councilmember Rice.
All right, I'm going to make this very quick. Dr. Gayles, this is for you. Yesterday we had a question about our Montgomery College and universities at Shady Grove and their opening plans. Great discussion with Education and Culture Committee. One of the things we've heard is that when it comes to some of our independent schools here in Montgomery County, they've already released plans saying that they're going back to school full-fledged, full classes, the whole 9 yards. So what is the role that you play as our county health officer? What is the role that the county plays in terms of approval of plans, and what is the role that the state plays? And how do we ensure consistency amongst all of our institutions of learning throughout the county, and making sure that we're not denying some who may want to have in-person learning that we know is better, but also, understanding the safety concerns, and also not giving advantages to those who can afford to pay for school and somehow maybe have some additional advantages.
Sure. So part of the reason why I have to shift and pivot out is because I'll be speaking and meeting with the school board this afternoon to talk through those very same things. So I need to prepare for that. So to address your question, so I will say a special shout out to our county school system, as well as the officials at Montgomery College and the universities at Shady Grove. They have all been very proactive in terms of planning and thinking through from the very beginning what it looked like to have COVID in this setting, as well as planning for the future. They've reached out to us in a consultation mode at different levels to be able to say, hey, can we meet with your team to discuss the strategies that we're putting into place? Again, all of this is in the setting of assuming that we move as a state to be able to reopen. And so, I think, and for the folks at home, I received at this rate in the last week, I'm probably receiving 75 to 100 emails a day requesting not to open up schools and different things like that. The school systems have been charged with coming up with contingency plans. And that's what they're tasked to do, is to say, in a best case scenario, if things do open up and we get to a point based upon the surveillance information where we feel comfortable that that is a doable option, they've been tasked with coming up with plans to do that. And so that includes all of the three that you mentioned. I will say I haven't had as many conversations, actually, I haven't had any conversations with any of the independent schools to date. However, if you're listening and watching, let us know. We'd be happy to meet with you all to talk through your strategies as well, to make sure that everyone aligns on the same page. And the last component that you mentioned is that it will be, helpful to continue to get input from MSDE. I know that they have been, their representatives have been meeting with the health officers to talk through strategies in terms of how to work with the local school districts. And so I have no reason to believe that that will continue to be the case as we move closer to the beginning of the school year time.
Mr. President, I know that I'm under budget, so let me just very, very quickly hone in on that point, because I think that it will be important for us to ensure consistency. Yes. If it's not okay for Bethesda Elementary School, it shouldn't be okay for independent elementary school to do the same exact thing but do it differently, right? And so from that perspective, I just hope that guidance is across the board and we're holding everybody to the same level. But thank you, and thank you, Mr. President.
Thank you. Councilmember Navarro.
Thank you, Mr. President. So a couple of items obviously before us. I appreciate the plan, the testing plan. I think as it's been stated, the regulation, this is just an introduction. I do have obviously an amendment and also some additional thoughts on making sure we're aligning what's included in the regulation to the way that we want to provide culturally appropriate services. So things like not specifically just mentioning fire stations, but perhaps leaving it a little bit more general, because there may be other sites that are a lot more accessible and or convenient and appropriate for particular communities. And so we'll work through those details, and I appreciate that. Also would appreciate that anytime we receive data, perhaps a little bit more of an explanation, because this was data that we received from you, Dr. Gayles. And obviously people were very concerned because they were not quite understanding the nuances, but we saw definitely, and I was one of them who saw the comparison between all of our groups and realized that there was a pattern that was positive for every other group except for the Latino community. Regardless of the nuances, there is still that particular piece. And so we are, as my colleagues know, working on a template of a particular initiative for the Latino community, which I think we should also replicate in our Black community. One of the things that I know I have learned through this process is that there's been a lot of particular best practices and lessons learned but somehow they have not been necessarily, in my opinion, done in a strategic way that builds a system. I also believe that this issue of the pandemic and the impact, that we have not seen the end of it yet. And so to the extent that we recognize that in Montgomery County, we do have these distinct populations who will continue to be disproportionately affected, how fortunate are we that we have a lot of not a human capital in terms of partners in the community, people within the county government, and a lot of assets that we can deploy to best address this. So not so much questions, but just stating that even though the data, as it was explained, is not what had been perhaps characterized out there, disproportionality still exists. And the feedback that we're getting from many in the community is that things are still pretty dire, especially in our immigrant and Latino community. So to that extent, again, we will be sharing. Councilmember Albornoz and I have been working very closely with all of you, with Dr. Kroll, with Dr. Gayles, the Latino Health Initiative, many people, to come up with a particular proposal that I think should get us to a much better place and address what hopefully won't be another very difficult time as the pandemic kind of cycles into a second wave, coming in the fall. So that's really just my comment, and I look forward to working with all of you on this regulation as well as this particular template. Thank you.
Thank you. Councilmember Albornoz.
Thank you, Mr. President. So starting with the good news, as you indicated, Dr. Gayles, we went from averaging at the height between 400 and 600 positive cases with a one-day high of 800 to now averaging 60 per day. And that is terrific news. And there is no question that there has been a lot of work by your team, the partnership between the council and the executive branch to get us to that point. But of those 60 or so positive cases that we are receiving, the fact remains that the significant overwhelming percentage of those 60 cases, still significantly down, are coming from the Latino and Hispanic community. And as you acknowledged in a conversation we had yesterday, that's a problem. And I think Dr. Crowell mentioned that all groups are going down. The concern is that the Hispanic community is not going down fast enough or nearly as fast as some of the other demographics. And so I also am concerned that that number doesn't fully represent what we are seeing on the ground. And there are unfortunately many families who have felt uncomfortable accessing government services and programs, in large part because of concerns over immigration status. And I have spoken to constituents who have run into this challenge. And so I very much appreciate partnering with Councilmember Navarro and the Latino Health Initiative, and appreciate conversations that she and I had with the county executive, where the county executive acknowledged that we need a more strategic and nuanced approach to fully address the holistic and unique needs and the challenges that are presented when working with that community. And so we have done a good job, but it's not mission accomplished. And there is still a lot more work that needs to be done. And my concern is that a lot of these folks work within the service industry, have continued to work throughout the pandemic, continue to have challenges of not being able to socially isolate because of their living arrangements within their communities. And as we've seen the spike in other jurisdictions, and let's not be naive, those people that are in Texas and Florida and Arizona and California will be traveling. And so we all have to brace ourselves for the possibility that because of the lack of a federal response, we are going to find ourselves right back where we started. And so I appreciate the clarification of the rhetoric, which is appropriate, but it does not dissolve the fact that we still have a problem on our hands that has to be holistically addressed. And I know we are going to work closely together to make sure that we achieve that goal, because we all have the same goal, and that's ensuring the public health of our entire community. And I know how hard we've worked up until now. So you will hear more information in the near future about this specific plan. And to Councilmember Navarro's point, this is a template that I think can be replicated in other communities to expand the reach. And I do very much understand the concern with being so prescriptive in the location of potential test sites in our draft plan, and completely agree that we need to be a little bit more flexible and nimble, and we will make those adjustments moving forward. But I think all of the general points remain important, and that we still have a lot of work to do. But I appreciate this briefing and all the other ones we've received to date.
Could just add one thing, Council President Pass? Thank you for the comments, Councilmember Alderson. You underscored right. That's again why we presented the data, is to say we've got more work to do.
Your audio was not as clear as it should be.
Can you hear me now?
It's better, but not great.
Okay. I'll try to enunciate and talk louder. Okay. So the points that you mentioned are important because, again, from a health perspective, that's why we reached out to say, hey, everybody, yes, we've made this move, but we still have cases. And not only that, one thing to emphasize that I didn't talk about, which is one of the things that we brought up in May, was the disproportionate outcomes in terms of COVID-related fatalities impacting the Black community. That persists, and what we talked about then holds true in this situation now. You know, the factors that are predisposing certain groups to having worse outcomes are related to social determinants of health, which we're talking about now. And I think it's important not to miss that. And I think, yes, there are, and this is just my opinion from public health, that there are opportunities to use templates to have those conversations, recognizing that there are nuances within different communities, but there's a lot of shared space too. And so when we're looking at the disparities in COVID, you know, I look back at our health status report, you know, there's significant disparities related to diabetes, heart disease, cancers, and those kinds of things, which perpetuate the disparities within COVID-related fatalities. And so I hope that is also addressed and not missed in the opportunity as we create specific plans and different outreach strategies to different communities, because what I see as a link from the 30,000-foot view from a population health perspective is these are all related to, as you mentioned, types of jobs people have, types of employment. Do I have sick leave? Can I telework? Can I afford to miss if I am sick? Do I have access to a provider to be able to get a test? Do I have health insurance? And so all of those factors that are part of this conversation remain a part of the conversation looking at health disparities overall.
I just want to respond to that really quickly. I couldn't agree more. We've made more progress in the last 3 months on telemedicine than we have in the last 13 years combined. And the pop-up sites, the hub model, all of these things we've been talking about for years. And as we come out of this, I really honestly believe we're going to come out of this stronger, specifically from a public health standpoint, because this has in many ways forced us to accelerate the strategies that we know we've had to implement. And I look very forward to working with you and the executive branch, particularly through the HHS committee, in moving that forward quickly. So thank you very much, Dr. Gayles.
Thank you. And I did also want to mention about for the what we're talking about for the resolution. As much as people know where fire stations are located, and as much as if there would be a possibility that we could use a prominent building like a fire station, that certainly would be something we should look into, or that Dr. Gayles and others should look into. But the reality is, in many cases, fire stations have a very limited parking lot and a very limited area else, even if not just for parking, but for other areas outside of the actual building. And they weren't built to be near mass transit. They were built to be near the areas that they were be serving. So I think we have to be careful on what we're discussing and how we do it. Obviously, the idea being that we want to have people be aware of where they need to be and on a continual basis. But I think we have to allow the experts to give us their best opinion on what they should be doing and where it should be done, but we need to be doing it quickly. And with that, Dr. Stoddard, I'm going to ask you and Dr. Crowell to give us an update as well, but we only have, by your own time frame here, 15 to 30 minutes. So please keep that in mind.
Dr. Stoddard, do you mind if I jump in quickly? Because what I have to say is specifically related to the planning and to the testing pieces of this, and I think I can be done in a matter of a couple of minutes with this, if that's okay.
By all means, go ahead, Raymond.
Thank you, sir. So just a couple of things, folks. One is that thank you for the time yesterday to have a chance to walk through this data to clarify the perceptions around the information. Dr. Gayles has done a good job of walking back through that today, and hopefully our public and the folks who are listening in will have a better appreciation for where we stand in the county and the progress that we have made. I think we've sent over a draft of the plan to you all, for review and for comment. And as I look at the resolution that you all are proposing today, I want to underscore, to echo, I think, the sentiments that Councilmember Navarro and Council President Katz have echoed around the prescriptiveness and not necessarily being overly prescriptive about locations and sites, but emphasizing the issue of getting sites and testing into people and in places where it's needed. I think that's an appropriate way to go, I think. What I believe is, as we look at what you finally come to a resolution, is that most of the elements that you've asked for will be represented in the plan that we have submitted, and we can tweak and make adjustments on that. The other thing is that I'm aware of, given the numbers, that there is some effort to come up with a template, as Councilmember Navarro and Albernas have described. We've not seen that. I've heard about it, and I've heard all kinds of things swirling around about it, but it would be a good thing to do to share that so that we can talk about it a little bit, so that we can figure out where it fits in the overall testing schema in the county and how it enhances that process and blends with it. So that I think it's very important that it not run in parallel and as a separate track, but that we do something that integrates that. So I think that's the request that I would make, is that if you all can send us pieces of that for Dr. Gayles and myself and Dr. Stoddard to take a look at, that would be helpful as we go forward to try to figure out how we ramp up our testing processes and efforts in the county. So that's my couple of minutes for that. So I thank you, Councilmember Katz, and yield the balance of my time back to you.
Thank you. And Councilmember Jawando wanted to speak before Dr. Stoddard does. So Councilmember Jawando, please.
Thank you, Mr. President, and thank you, Dr. Gayles, Dr. Stoddard, Dr. Crowell, for all your work in the plans as submitted and clearing up some of those misinterpretations. Obviously still of great concern, and I'm glad we're moving forward, excited about the Silver Spring testing today. I've already been monitoring social media. It looks like it's going well so far. A question related to test turnaround time. I've been getting a lot of questions. That's obviously nationally a huge issue. I heard horrible stories out of Arizona. It's taken like a month or something. Obviously here, it can be a week, depending on who you are, where you are. I've heard some reports out of CVS specifically of slow turnaround times. This is something I just wanted to know, what's the latest on that? What can we tell residents? How are we addressing it? How are we working on that?
Sure. So I think there are two layers to that conversation. So first, we're sorry that people are experiencing that again. And again, it's not us on the testing. It's on the lab capacity, because what's happened is the large private labs. Originally, months ago, there was a shortage of tests, so you couldn't get them in, and then there was capacity issues, and they built all of these different new regional centers to run and do lab analysis. And what's happened is we were coasting along, moving along fine, able to address capacity and get the test out. In the last 2 weeks, as these states have been hit with new cases, testing has increased significantly. So you've seen record cases in Florida, Texas, and California, 3 of our largest population centers. And so the volume of tests that are being run out of there has increased exponentially, even more so than the cases. And so right now, the private laboratories have been literally slammed in trying to meet the demand, which has caused the delay in the results getting back. And I think it's another inflection point in terms of, one, them needing to build up capacity even further from where we were. And I know that they worked very nimbly and quickly to address that when we had the first wave of that several months ago. So I feel hopeful that they'll be able to address it. Even we've encountered some issues with our local lab due to some logistical things as well, and we've worked with them to address it to be able to get people get results quickly. Because the challenge is ultimately if you test and you don't get them for a while, it really does hamper the ability to do effective contact tracing. So, for example, if you were tested today and you get your result in 7 to 10 days, where have you been within that scope? And we just have to hope that folks are isolating at home or quarantining in that place. And it introduces an opportunity for us to reinforce that message of if you are getting tested, if you're symptomatic or you've had a high risk exposure, to quarantine yourself and not go out during that time period to minimize risk of transmission. And so I say all that to say that, unfortunately, right now, I expect that the delays in testing will probably be with us for a number of days to come. But the hope is that the labs will be able to ramp up capacity to absorb the shock to the system that these larger states have provided.
Okay, and it's important for the millions watching at home, literally, as I always say, to know that. One fine point on what Mr. Rice brought up, which I have to emphasize, the difference between parochial and independent schools and MCPS. And I just want to make sure I heard you correctly, that you intend to issue guidance for both that is exactly the same at some point.
Well, I think from the health perspective, I mean, I think, if consultant, we, be able to provide that. And I think that, working again with the state education system as well as the MDH, I think, we will work to be on the same page because consistency is important, particularly within this area, related to equity and all those other factors that may come into play as a result of the decisions moving forward. So as best as we can say, we will work closely to make sure that we're aligned. Now, certainly defaulting on the side of whatever strategies are safest for our students and our teachers.
Right. And if there are limits to your authority, the independent school, I need to, this is maybe not a question for you, but you can make a health order for the schools. And I just want to make sure we're 100% clear. There's not going to be a separate, it will be an order and it will be for all students in Montgomery County. Yes.
Yeah, I was going to chime in here because I think it's really important to make.
And I'm done. Thank you. But go ahead.
Thank you. Yeah, and you're right at 5 minutes. Council Vice President Hucker, please.
Well, Earl was going to, could you just let Dr. Stoddard respond to that point?
It's related to what Councilmember Tondo and previously were raised. I will, because I've heard Dr. Gayles say this today. Elementary or school-age children are not going back to school in the short term. The numbers don't support that. The MCPS plan has it extending into October. I do not see a situation where MCPS is extending into October for bringing students back. And again, that's conditions permitting. And parochial schools are going back in August full-fledged. That's just not going to happen. And so if there's a parochial school out there planning to have 5 days of school, full classrooms in August, they should talk to us because that's probably not going to happen. I don't want to, I think that's the clear message we should get out there, and, I don't want there to be any ambiguity about it. Yeah, call us for sure.
Thank you.
Thank you. Vice President Hucker.
Thanks, gentlemen, for everything you're doing. Thanks to Gabe and Hans for your leadership on this plan. Dr. Gayles, just before you go, can you just clarify, better coming from you than from me, for the Silver Spring site today, for the 8 pop-up sites, do you want people who have symptoms to get tested? Do you want people who believe they have been in contact with somebody with COVID to get tested, or do you want everyone to get tested?
Well, so the tests are open for everybody. So if someone needs a test, come do it. We're not going to turn folks away.
That's right. Anybody who wants a test can get a test.
So right? For folks who are symptomatic, we do request, you have on, well, everyone's got to have on face coverage, those kind of things, but let staff know so that extra precautions can be taken to address that, and, mitigate any potential risk of transmission from person to person beyond what's already in place.
But to clarify, that's true of everyone. It's up to the individual, right? Anybody who wants to get a test should feel free to go get a test. And that's a good thing to do, and it helps everyone. Okay, great.
Yes.
Thank you. I'm out.
Thank you. Dr. Stoddard, by your own time frame, you have at least 4 minutes. So go ahead.
I have a few things I want to highlight, and they actually stem from the conversation we had on Friday. We are doing targeted messaging using geo-targeting Facebook ads. That's something, based on recommendations from council members we're pursuing. Also working with Telemundo to do targeted Spanish TV advertising around particularly the clinic locations starting this week. I think ads are already running, and we're going to continue to do that. We are working, I know this was a conversation, this is not an HHS only issue, this is an entire executive branch and frankly community county-wide issue. So we are supporting Health and Human Services. We had a meeting to discuss, this expanding strategy, how many additional county employees will be needed, not just to do the testing itself, but also to support the call center where a lot of the test inquiries are coming in. So as we expand testing, we know that we need to expand the ability to respond to the inquiries coming from the public. We're working with public health to identify non-HHS staff to help support that effort in a much more expanded way. We're looking for probably in the area of 250 additional county employees, and or if we can't get that number from county employees, bringing in contract support to help them do that. So this is all surging in line with the strategy. We're supporting their effort with that logistical support, particularly as it relates to personnel. The only other thing I do want to highlight, we've talked a lot about other things, is we did get a letter today from the governor's office related to the enforcement of public health orders. I'm sure you will have seen it on his social media at this point. We're ahead of that. We're already doing all the things that he recommended that we be doing. We are partnering between alcohol beverage services, police department, county health and human services, and other inspection agencies to increase our ability to do inspections. We did have a couple locations that were shut down on Saturday night as it relates to physical distancing. We have another additional one that had a citation issued, and we had a handful of others where we just educated them. Our goal is, and I think it's really clear that we point out, the overwhelming majorities of businesses are doing exactly what they're supposed to be doing. And we appreciate that, and we want to call them out as much as we identify that there are people who are not. And those willful, and I think the governor's words were, those willfully violating, we need to stop that, because that will be a source of potential disease spread. And so we're following exactly the same strategy that the governor has sent us a letter today to implement. And so just wanted to let you all get that update to you all. I think I'll stop there.
Thank you very much. It's my understanding that Councilmember Albornoz has a motion for the introduction. No?
Yes. So I'd like to.
That look on your face, Gabe.
No, we further need to clarify, but we are going to move forward with the resolution, acknowledging that there's still works that needs to be done between now and the formal implementation at the next council session next Tuesday. But this will move the resolution forward so that we can engage in those conversations, address the issues that we talked about, and merge the two strategies.
Second.
Thank you. It's been moved by Councilmember Albornoz, seconded by Councilmember Rice, that this be introduced. All those in favor, please raise your hand. And that is unanimous. Thank you very much. Thank you very much to Dr. Gayles, Dr. Stoddard, and Dr. Crowell for being with us. And we appreciate all your hard work and all your efforts.